is Bridging Health Care, and I am your host, Bridget. Thank you for joining me on this channel. The main focus is helping us to become highly effective healthcare worker, bringing informative, educative solutions to our world. I am so happy you're here. Sit down, relax, like, share, subscribe. Thank you. Hello guys, and welcome to my channel. How you doing? How's work? This is Bridget Ezobiako from Bridging Healthcare, and it's an honor and my privilege to welcome you to my channel again for another class of a very, very effective, efficient training so that you can be the best in your field. This channel is dedicated to giving very useful, educative, and informative ideas on health and social care, how you can be efficient at your job. We talk about topics under health and social care, what can make you stand out, what you will find, what makes health and social care one of the best fields on the planet. All right, as a matter of introduction, for those of you that have not been to this channel before, I am a healthcare professional and my name is Bridget Ezobiako, and presently I'm taking my master's in dementia, and I'm so excited, and I'm also in the field. So it's my honor and my privilege. Always remember to subscribe, like, and share. Tell your friends about it. I've got a lot of videos on this channel that you just need to watch it and inculcate it into your career, and you will be amazing. And I don't only talk to just carers. I talk to everybody in the health and social care space. This includes doctors, nurses, support workers, physiotherapists, occupational therapists, and mental health nurses, and all that. We deal with everything that cuts across health and social care. Thank you very much, and let's dive into the meat of the matter today. Today is huge, is massive. What we're going to be discussing is interesting. Now, for the next couple of weeks, I'm going to be discussing disease conditions that you will find as a healthcare professional. And, you know, even if you're not a doctor, a nurse, an oncologist, a professional person, in a therapist and all that, you still need to have a bit of knowledge of these conditions, because you will find somebody in that state in the course of your work, you know. And basically for healthcare professionals, you will find somebody that has a particular condition or the other. That is why you are there to support them, because they cannot do things on their own. And that is why you need to have like a head knowledge, an idea of what the person is going through. Number one, it will help you to walk with empathy. It will help you to walk circumspectly. It will help you to walk knowing, you know, having a knowledge of, you know, so if you get to a client and the client is giving some kind of activities or showing some kind of character, you can be able to tell this is probably what is happening, and you know when it's an emergency and when it is not an emergency. So I'm going to be picking different health conditions and I'm going to be discussing it. So sit down, relax. Today it's going to be more of introductory, but I'm going to pick on one condition that is very common and we're going to break it down. And today I'm going to talk about cancer. I'm going to talk about cancer. The mere hearing of cancer, it's scary, right? Everyone is scared of cancer. Oh, it doesn't have cure and all that. Well, today we're just going to touch on different types of cancer and what a cancer is in layman terms and how you can understand what a cancer is. So now, as a means of introduction, let's assume that you don't know anything about healthcare. What is cancer? Before I go to a proper definition, I want to give you a background knowledge. A cancer is a cell that develops in the human body. Not only human, animals also have cancer. Yeah, but in the context, we're talking about people, right? In the human body. And you know, every cell in the body is made up of cells. Cells come together to form tissues come together to form organs, come together to form system, and the whole body is made up of different systems, right? Basic biology. Now, a cell is the unit of life, and they need what is called adenosine triphosphate to survive, ATP. This ATP is like their food. It is what is called energy. It's what is converted to energy. Now, ATP is derived from food. So when your glucose from your food, your carbohydrate is broken down, it breaks down further. The body has a way of metabolizing it into adenosine triphosphate. And this adenosine triphosphate is what the cells feed on. Now, these cancer cells develop in the body. They are not cells that the body need, but they are dead. It's not the cells that kill the body. It's because the cell is a very greedy cell. It feeds on the useful cell, on the food that the useful cell needs. So let's assume that a person has the cancer in the brain, and the cells in the brain needs to feed on what? ATP. Now, this cancer cell, like a weed, what do we know from weed in basic agriculture? Is a plant that is growing where it's not wanted, right? So this cancer cell, see it like a weed. So it's growing in a particular part of the body that it is not needed. It's not giving the body anything. It's not useful to the body in any way. Now it's taking space, and then it's feeding on all the food that the cells that the body needs is supposed to feed on. So they are so aggressive that when they feed and grow fat. They take more space, and the cells of the body that need it to convert into energy for the body to use, for the brain to use, is starved. And before you know it, those cells start dying, and these other aggressive cells start taking off space, and it becomes a problem. So now, that has given us a simple explanation of what a cancer cell is. And a cancer cell can be very, very aggressive, like I said. And so when it is discovered, it starts growing, and something is growing. Now, the body cell understand. Let's assume that somebody has a cancer in the thyroid. The body understand that when you swallow, this place is supposed to be this shape. So even if cells want to develop, they will develop along the shape that the body is meant to be, right? Based on genetic organization and all that. But these cells, this cancer cell, they just grow. So you will see they will obstruct things, and that is where the person starts having a problem. There are different types of cancer cell, but I'm going to be discussing 4 main types of cancer cell in this class. There is the carcinoma, and a carcinoma begins majorly in the skin or in the tissue that covers the internal organs. So what are the internal organs? You have your stomach in your body, you have your kidney. So it can start on the skin that covers that internal organ, and on the glands as well. And before you know it, it will start growing to form a solid tumor. So it just grows and becomes a problem. So example of these carcinomas are prostate cancer, when it is growing in the prostate. The name is given based on where it is growing. So we have breast cancer when it is growing in the breast. And then you have cancer of the lungs when it is growing in the lungs. You have colorectal cancer, that is when it's going in the colon or in the rectum. You know that the colon is everything GIT down. Okay, after the abdomen, you have the small intestine, you have the large intestine, then you have the rectum. The large intestine is what is called the colon. And that is where carcinomas majorly grow. And you find out that these people start having difficulty, obstructions, and it can be very painful. Carcinomas can be very, very painful. You will see that even for somebody that has a prostate cancer, to catheterize can be very difficult because the cancer will grow and cover where urine comes out. So you see that the person is having difficulty in passing urine, and very painful. And sometimes it is bloody because where the thing is trying to force, it can brush over. And so many, carcinomas can be very, very destructive. The next type of cancer I want to talk about is the sarcomas, and they begin in the tissue. this tissue that supports or connect the body. So they develop in fat muscles, in the nerves, in the tendons, in the joints. And so you see them in the cartilage, in the bones, in all those joining organs, all those parts that join. Like you have the tendons join the bone, to the muscles, and all those funny places. That is where you find sarcomas. Then you have leukemia. Leukemia is a type of cancer that is the cancer of the blood. It begins with healthy blood cells, and it changes the healthy blood cells, and then it begins to grow uncontrollably. There are 4 major types of leukemia. Leukemia can be very deadly, and it can even cause the person to, their blood will just be dropping. They will not have platelets. They will be weak. You will see stooling, vomiting. It can be very terrible, but it's also treatable. Leukemias are the only cancers I've had that are treatable, and there are 4 types of leukemias. You have the acute lymphocytic leukemia, you have the chronic lymphocytic leukemia, you have the acute myeloid leukemia, and you have the chronic myeloid leukemia. Now, for the base of understanding, leukemia is a cancer of the blood. The next one I'm going to talk about is lymphomas. Like it says, lymph, cancer that grows from lymphatic system. And the lymphatic system is a network of vessels and glands that help us to fight infection. So when we talk about white blood cells, what fights infection? Now, when cancer is now growing in what fights infection, you find out that the person cannot even fight, their body cannot fight, so their immune system drops and they break down quite easily. And there are 2 types of this lymphomas cancer. You have the non-Hodgkin lymphoma and you have the Hodgkin lymphoma. Now, haven't discussed that. Cancer is huge, like I said, but when you know where the cancer is located, you'll be able to understand the symptoms that the client is having. And when the person is giving you signs, you can know what to do based on your care plan. Cancer spreads quite easily. Most people that have had one cancer, before you know it, they start becoming more than one cancer. So one person can have more than one cancer. One person can suffer from more than one type of cancer. So you can have somebody that has lymphatic cancer that's targeted the lymphatic system, and then you see that the person is still having a tumor somewhere, because of course the lymphatic system that fights anything that is not supposed to be is already weak. So you start finding cells, they may grow and develop into new tumors known as metastasis, and this is another type of cancer. And before you know it, it starts spreading. If that tumor is checked and there are cancer cells there can be a tumor without being cancerous. So that's why when you see people that have prostate condition, now you need to check. They will take a sample from them, and then they are going to take it for histology. And histology is checking the cells, carrying out tests on the cells to know if they are cancerous. So somebody can have a prostate condition without a cancerous prostate condition. So that way they call the prostate benign. Therefore, in that person, the person will still need to do surgery because some cells have grown out of normal. Now, but where growing out of normal may not just be the child. It is when these cells start mutating and then they start fighting the body, you find out that a cancer has occurred. Diagnosing cancer they need to do a lot of scans, mammogram, pap test, flow test, histology, MRI, brain scan. There are a lot of different kind of tests that can be done. But for the purpose of this class, I just want to give you a few symptoms that you may see in different types of cancer. That this is an introduction to cancer. So in the next class, we're going to be picking some cancers, some specific common cancers, and what you should expect. If somebody has a cancer of colorectal, that's a cancer that is affecting the GIT, You find out that the person's eating can be very poorly. You can find out that the person vomits all the time. Maybe they cannot hold their food down. Once they eat, they vomit, or they have diarrhea, or they have constipation because their stomach is acting up. Then you can see that sometimes, diarrhea, the person is stooling. You can see that the person may have severe pain. The person might be suffering from severe pain. An unexplainable pain, a pain that cannot be calmed, a pain that sleep cannot calm it, and they give medications for this. But this kind of pain, when somebody has been in pain for so long, you start finding out that the person is aggressive, the person is unhappy, depression sets in. So cancer can be it can affect everything. Then, if I talk about breast cancer, it starts with a lump, and then they go for histology. They take a sample from it and go for histology. And if it is cancerous, and if they need to do chemotherapy or what, then they start treating, and or radiography, however the radiotherapy, whatever the situation is. But by the time the cancer starts progressing, you will see that there can be big sores that they just don't want to heal. If you look at on the breast, most of the time, from my own experience and a few that I've seen, the sores, they ooze out, I like to use nice words for them, because the view can be very gory. You keep dressing and dressing and dressing, and after some time, they might have to do away with that breast so that it doesn't transfer to the other breast. And it comes with a lot of symptoms. It comes with hot flushes, weight loss, the person might have breathing challenges, severe pain, generalized body pain. It can be anything, and it can be so devastating. It makes the person weak, they are confused and all that. Cancer is a very deadly condition. And the earlier it is discovered, the better. A lot of people have recovered from cancer. Now, as a healthcare worker, you are taking care of a cancer client. You have to be extremely patient. You have to have your eyes on the road, because if the person is having some form of pain, there should be a first aid. There should be what to do if the person has gone this stage, and there should be what to do if the person has gone this stage. So you need to record everything that is happening, and you need to always be on the look. If the person's, changes in their action, or their character changes today, check. It might just be that they are deteriorating, and a cancer patient can be okay today, and then the next day, the nose dive down, and after some time they can come right back up. So it's a very stressful condition, and therefore you have to work with a lot of empathy for your clients. You have to work with a lot of empathy, because cancer can weaken even the strongest person. But if they find out about it early, it can be nipped in the bud. Thank you so much for joining me today. And I hope that this discussion is going to be worth listening to and useful for you as a care professional. This is Bridget from Bridging Healthcare. Remember, in care, we do it because we have passion to see that there's a smile on the face of people. And so if you don't have that passion, build it. You can grow that passion. Find it. That is the only way you can be highly effective and efficient at what you do. Thank you so much. And please don't forget to subscribe, like, and share. This is Bridget from Bridging Healthcare. Ciao. Bye.